In Mali, 1 in 5 children don't live to see their 5th birthday. Acute malnutrition affects around 10% of children under the age of 5. Malaria is still the leading cause of child mortality in the country, with pneumonia a close second. Yet there are now straightforward measures for preventing and treating these diseases. In the health zone of Consigala, Médecins Sans Frontières is running a paediatric programme in partnership with the Ministry of Health that incorporates these measures into a comprehensive healthcare programme targeting the main causes of child mortality.
Ce projet a démarré en mars 2010.
The project started in March 2010. The big difference between this project and what MSF usually does is the prevention component. I think it'll have more impact on mortality rates. The prevention activities target children under the age of 2. The project's aiming to bring child mortality rates down by adopting a decentralized strategy adapted to a setting where resources are limited.
Once a month, the mobile vaccination team visits each of the 17 villages in the Consigala health zone. The children are vaccinated according to the National Immunization Programme, which since 2011 includes a vaccine to prevent pneumococcal infection, a common cause of pneumonia. Thanks to the vaccination programme, children are registered at a very young age, within a few days or weeks after birth. Salia Kone has brought her youngest child, who is just 20 days old. The programme is explained to her and she is asked whether she wants her child to participate. Then she is given a health record book for the child's follow-up.
We fill in the child's name and age, and then we give the health record book to the mother. We ask her to come back to Consigala Health Center when the child is 30 days old for the first consultation and to collect a mosquito net. We use the same health record book to follow the child from the first vaccination through to the last one at 9 months.
Before MSF arrived, things were not very well organized. There were a lot of breaches in the cold chain and big procurement problems, with vaccines not arriving on time. There were motorbikes, but they were always breaking down because they were never serviced. We began by improving the cold chain and the procurement system, and then we organized visits to the different vaccination sites. And the results have been very good, especially in Consigala. Vaccination coverage is now more than 98%.
Gafore Kone is 18 months old. His mother has brought him to the health centre for a checkup and to track his growth. Between 6 months and 2 years of age, the children admitted to the programme have 5 follow-up consultations. Gafore is immediately weighed and measured and his arm circumference is checked. He is screened for malnutrition and if he needs it, he'll be put on treatment.
I'm just checking that the child isn't suffering from severe or moderate malnutrition, but in fact he's in good health.
The consultation didn't reveal any problems. Gafore is a healthy boy and his vaccinations are up to date. Now his mother just needs to collect his food supplements. He's given 1 tub a week. At 6 months, a child's diet needs to be diversified. Breast milk needs to be supplemented with foods that are rich in minerals, vitamins and proteins. Milk-based food supplements meet these needs. Gafore will be given these supplements until his next consultation, which will be his last one at 24 months. He was given a mosquito net to prevent malaria when he was first admitted to the programme, and he'll be given another one on his last visit.
Children under 2 often pick up infections, and there are lots of cases of diarrhea and malaria. These food supplements help strengthen their immunity. And this makes a huge difference, because the children on food supplements develop well. Even when they're ill, it's less serious. We often treat them on site, and we don't refer them.
Jara and Noum Kone live in the village of Consegala with their 12-month-old son. His mother carefully follows the nutrition advice she was given when her son was admitted to the program.
I give my child 2 spoonfuls of the supplement every day, and in the week, I also give him rich meals with egg or something similar. With the supplement, this is really good for him. It's making him strong. He doesn't get as many fevers, has fewer minor illnesses, and he walked really early. I've noticed that with the supplement.
As well as vaccinations and the monitoring of children's growth until the age of 2, children up to the age of 5 are also given access to free healthcare in the Consegala Health Centre. This is the programme's curative component. These consultations aim to treat children for the most common diseases, such as malaria, diarrhea, and respiratory infections. These consultations always include screening for malnutrition. Children with severe or acute malnutrition are referred to the outpatient program for treatment. The more complicated cases are referred to Kutiala District Hospital, about an hour and a half's drive away. Here, Msf manages the paediatric inpatient and nutrition services. Malaria is the primary cause of hospital admission and death. During the high transmission period, the number of children in the hospital can go beyond 300. Msf has been looking for ways of detecting and treating malaria at an earlier stage.
In
Consegala, there are 17 villages. In each village, we have a contact person who is a community worker and who lives in the village. They help us to do the vaccinations and to treat cases of simple malaria for which there are no complications. We've taught them to do a simple and rapid test that tells them whether to put someone on anti-malarial treatment. And all the complicated cases, or people whose test was negative, are referred directly to the health centre.
The rapid diagnostic tests for malaria have revolutionised the management of this disease. They detect the presence of parasites in just a few minutes, so we can immediately tell whether a fever is due to malaria or to one of many other possible causes.
We've taken his temperature. It's high. The test has confirmed he's got malaria. He also has diarrhea. We've started him on malaria treatment, and now we're going to refer him to the Consegala Health Center, mainly because of his persistent diarrhea.
After a bite by an infected mosquito, it takes about 3 weeks for the clinical signs of malaria to appear. If we administer preventive treatment during this incubation period, we can stop the disease from developing. This year, during the high transmission period in August, September and October, Msf distributed combination anti-malarial drugs once a month to more than 165,000 children aged 3 months to 5 years throughout the Kutiala Health District. This is the first time seasonal malaria chemoprevention has been carried out in actual field conditions.
Until now, when children had malaria, we could only treat them once they were already ill. But this year, we've started doing preventive treatment. So during the rainy season, the season when we have the most malaria, we give them a course of treatment at the beginning of each month to prevent them from contracting the disease.
The initial results have been very encouraging. There has been an almost 70% reduction in the number of patients admitted to hospital with serious malaria in the district of Kutiala. Ami Diabate lives in the village of Finsankoho. Her 3 children have been given the preventive treatment.
My children used to get fevers all the time. Since they've started taking these medicines, they've had almost none. I used to take my children to the health center about 3 times a month. Now it can be more than a month before I have to go back.
The paediatric program in Consegala is based on a series of simple measures: vaccination, prevention and early treatment of malaria, and food supplements specifically designed to prevent malnutrition. A glance at the growth charts of the children admitted to the program shows how effective these simple measures are.
We have a good participation rate, which stands at 95%. And the most important thing is the big reduction in mortality rates. According to what the villagers tell us, since the program started, they've seen fewer and fewer deaths in the villages. There are fewer and fewer children's graves in the cemeteries. This is remarkable news, and it encourages us to keep going.
When my son was 6 months old, he started getting the food supplement. He has also received all of his vaccinations, and he's been fine. He doesn't get ill, and he doesn't get fevers like his older brothers and sisters did when they were his age.
The children used to say they didn't feel well. That's changed too.
I've really seen the benefits of this project. Since it started, we don't hear about children dying so often. The supplements help us to keep malnutrition at bay.